For this week's clinical file, we have Mia, and Mia is being treated by a student physical therapist who elects to use a moist hot pack post-therapy. Which of the following is the least likely to result in a thermal injury? So we have A, the use of 4 terry towels between the hot pack and the patient's skin. B, a hydrocollator temperature set to 158 to 167 degrees Fahrenheit. C, treatment area check after 10 to 15 minutes. And D is a moist hot pack with interferential electrical stimulation. All right, so this is a pretty straight up question right here. There's not a lot of information in it. I mean, it's pretty much a sentence and then the question that follows the actual stem. So let's go ahead and knock this one down. So we have Mia is being treated by a student physical therapist right there, not really telling me too much, right? I don't need to reflect on that too much. It says, who elects to use a moist hot pack post-therapy? All right, so for that sentence right there, it's just setting us up, not really giving me a lot to go off of other than the fact that I'm using a hot pack post-PT. Now, which of the following is the least likely to result in a thermal injury? That's it. Which of the following is the least likely to result in a thermal injury? So I'm going to go ahead and slow up for a moment for 2 reasons. Number one is anytime you ever see like a negative modifier, like least likely, all right, or worst, or something like that, you got to pay very close attention because it's easy to get the question wrong because you're so used to seeing like most and best and next and all these more positive words. So you got to be very careful not to make a simple error here. Remember, we're looking for the least likely to result in a thermal injury. So that's number one. All right. Number two, when you're looking at these questions, we need to make sure that, you understand that sometimes you're just going to have a decent amount of knowledge to get the question right. I mean, there's really no substitution for good knowledge, but we can still use strategies. All right, so let's go ahead and look at our answer choices. We have A, the use of 4 terry towels between the hot pack and the patient's skin. B is a hydrocollator temperature set to 158 to 167 degrees Fahrenheit. C is treatment area check after 10 to 15 minutes. And D is a moist hot pack with interferential electrical stimulation. Let's knock these down, starting with A, the use of 4 terry towels between the hot pack and the patient's skin. Okay, so when you go to look this information up, you go into your modalities textbook, Cameron, Miklovitz, possibly you remember back from PT notes. Did you go over the terry towels? I mean, because it is in there. It's in the text. And they talk about these terry towels, which are specifically used in these cases to insulate, all right, to decrease the amount of heat transmission, all right, from the actual hot pack itself into the patient's skin. We don't want to rapidly heat the skin too much because we can create the burns, right? And so we need to have a certain level of terry towels. Now, there is a lot of this or that when you look at textbooks and so forth. Some texts are saying this and some texts are saying that. And maybe in the clinic it's different for you. But I will tell you on the NPTE, the general consensus is 6 to 8 terry towels between the hot pack and the patient's skin. That's what is required to reduce the risk of a thermal injury. All right. And so I look at A. A says the use of 4 terry towels between the hot pack and the patient's skin. Well, hey, I mean, is that going to create a situation where I potentially will burn the patient? Yeah, I need 6 to 8. If I'm only using 4, that's likely to burn the patient. Guess what? That can't be the right answer. Why? Because I'm looking for an answer that is the least likely to burn the patient, or least likely to create a situation where the patient will get burned. A is not the right answer. So let's look at B. B says hydrocollator temperature set to 158 to 167 degrees Fahrenheit. All right, so if that word hydrocollator kind of threw you off, maybe you haven't heard of it before, or you're like, what the heck is that? Again, if you go into like an outpatient clinic of some sort, hydrocollators are very common. They're usually in the corner somewhere, and then your moist hot packs sit in there. It's just like a dang pot of water that's not necessarily boiling, but it's hot as heck, right? And you put your moist hot packs in there. Okay. And so that's what the hydrocollator really is. And if you go into your textbook, it is going to talk about a certain range, temperature range, that you should keep that water at. Well, I'll tell you right now, it should range somewhere in that high 150 area to the high 160s. All right. Well, this answer choice says a hydrocollator temperature set to 158 to 167 degrees Fahrenheit, which is within the normal ranges for a hydrocollator. All right. It's not too hot. It's not too cold. So my question to you is, if I'm using the correct hydrocollator temperature, is my patient at risk for a thermal injury? Well, if you don't do things right as far as setting the patient up right, or if you don't use the right padding and that sort of thing, yeah. But I mean, the hydrocollator set at the right temperature. My patient's not necessarily at any more risk for a thermal injury. So what am I saying to you? I would say that right now, this is a pretty good answer. Right now, it is the least likely to result in a thermal injury. I haven't looked at the other answers yet, but right now it's the least likely. We all on the same page? All right, so let's move to the next answer. It says treatment area check. So looking at the patient's skin after 10 to 15 minutes. Well, here's something that you need to know. That within the first 5 to 7 minutes is the hottest or the most likely time that the patient will get burned. In that first 5 to 7 minutes, I mean, you're really getting that really peak heat. All right. And so if the patient was going to get burned, it's usually within that 5 to 7 minute period, but up to 10. All right. So what does that mean for you? That you better be checking your patient's skin after 5 minutes. I really wouldn't go much longer than that. Well, this answer says treatment area check after 10 to 15. Baby, that's too late. By then, the patient would have been burned. And so that is a risk for burning the patient. And it can't be the right answer. Again, I'm looking for the least likely to result in a thermal injury. B is the best answer for right now. B as in boy. Let's look at our final answer here, D. D says moist pack with interferential electrical stimulation. So a lot of people selected this answer, and I want to really go into it because we got to really see. Moist pack with interferential electrical stimulation. One thing I will say is that I like this answer from a standpoint of what it does for the patient. I like it because the moist hot pack can help with pain. It can decrease muscle spasm. I know the interferential current can be used to decrease pain as well in muscle spasm. So I like it from a treatment perspective. Both of those together is very, very therapeutic. But that's not what the question's asking. The question's asking which of the following is the least likely to result in a thermal injury. So we got to make a case for the burning aspect of it. Well, when I think about it, if you put a hot pack on somebody and they're not able necessarily to tell you accurate information about what they're sensing, what they're feeling, that would result in a burn, right? I mean, if your patient couldn't tell you 100% whether it's burning them or not, that would be a risk for a burn, right? Well, see, that's what I'm kind of thinking about this whole D answer. It says moist pack with interferential electrical current. The one thing I know that IFC does is it gates pain, right? It changes your sensation. It's putting in these electrical currents into your body in order to block pain. And so I would say, yeah, even though this is very therapeutic and it can help with pain and muscle spasm, I would say that you are at a greater risk if you're using this device that I know changes a person's sensation. So your patient may not be actually able to give you reliable information as to how hot the pack is becoming or how hot their skin is becoming. They may not be able to give you that. And so if they are falsely reporting, then now you're placing the patient at risk for a thermal burn. Yeah, thermal injury. And so, you know what? The best answer here, I would say, is B, as in boy. The hydrocollator temperature set to 158 to 167 degrees Fahrenheit. Why? Because that's normal temperature for a hydrocollator. That's not necessarily putting my patient at any more risk for a thermal injury. But having the moist pack on with interferential current, yeah, let's place my patient at risk for a burn. Now, we have to definitely check the patient after that 5 minutes and make sure that they're not burning, but definitely the IFC will potentially be something that will result in the burn. Now here's the deal. We want to make something very clear that we're not saying that the IFC or the electrodes are creating the burn. But again, they're blocking the patient from being able to give you really good, accurate information about how hot the hot pack has become. Congratulations to those of you who got this question correct. Again, the answer is B as in boy. This is not an easy one. You know, on the NPTE, you can easily get questions that are targeting modalities, targeting these things that when you look at yourself, you're like, man, that's so freaking basic. Hot packs, come on. But sometimes when they give you the numbers or the specific procedure related to them, we're kind of like, dang. You know, even that most basic stuff you can't remember because maybe you haven't done it in a while. You haven't seen it in a while. You haven't touched a hot pack. You don't even remember the hydrocollator temperatures, right? And so these are areas that we need to brush up on every once in a while to make sure that we're prepared for questions like this. Make sense? But for those of you on the podcast, you know, I never want to leave you just with that basic explanation. I want to take you to the next level. And so what I got for you is another amazing cheat sheet to help you with the top facts, the must-know facts about thermotherapy for the NPTE. If that's something that you're wanting, if you need help in this area, you think that you're possibly going to get a question and you may not know, you need to check out that cheat sheet right now. It's in the show notes. Click the link in there and get it.